It's a great honour and pleasure to be here. I would like to also acknowledge some elders. There's some people in this room with more grey hair and more age than me, and I'm 54, and I'm not going to name anybody because I don't want to embarrass anybody, but I just want to acknowledge that there's some men in the room that I owe debts of gratitude towards, at this table, at that table, definitely that table. And I just want to acknowledge all the work and effort of the elders that have supported me over the years as well, and especially around this topic of men's health and wellbeing. So I'm a men's health advocate, and the work that I do day to day is talking about this sort of thing all the time, everywhere I can go. And I'm also on the board of the Men's Health and Wellbeing Association. 8 years ago, the federal government created the first ever national male health policy. Now our state is producing a policy that follows on from that and creates real incentive and direction for WA and males' health and wellbeing. Good. Men can be and are significant and positive contributors to life in WA through their diverse family, work and community roles. They need to be empowered to continue this positive involvement, allow young men to reach their potential and to support all men and boys to enjoy a long and high quality of life. The Men's Health and Wellbeing Association here in WA has been operating for over 20 years and highlighting the need for a policy like this. We have achieved some innovative successes and look forward to playing a key role in the future in men's health and wellbeing in WA. And it's very, very pleasing to see it take shape. It was at the first forum on the 15th of this month, and this is the second one. It's going to be a wonderful morning, and the sessions around the tables and the way Tim and his team do all this, it's really going to be an outstanding few hours together. So even though men and boys can be positive contributors to the state and wellness overall of the state, there's some bad news. So men continue to face poorer outcomes than women on almost all measures of key health and wellbeing indicators. They have lower life expectancy, 5 years approximately, and have higher levels of mortality from almost all non-gender specific causes of death, including, some of you know all this, injury, cardiovascular disease, cancer, suicide, respiratory disease and obesity. In WA, males experience a greater total disease burden than females. Indeed, 30% more of the burden of disease in WA is carried by males. Now, just that last sentence should be enough for all of us to put down our pens and paper and immediately go out there and do something about that. Just that last sentence should be enough for all of us to stop what we're doing and set about fixing that. So many men and boys are going to be helped by this policy. So these health outcomes, poor health outcomes, are primarily influenced, as most of you I'm sure are aware, by levels of disadvantage, social and lifestyle factors such as smoking, excessive alcohol, low fruit and vegetable intake, poor diet, poor nutrition, participation in high-risk activities, especially young men risking themselves, tendency to use health and community services less and at a later stage when encountering a health or illness concern, and poorer social connections. Now that's a pretty good list of how things get to be the way they are. And our boys, young men, are growing up in this environment. Males have a much lower health literacy than females. The national female health policy, women's health policy, 25 years ago. We're about a generation behind. The men are about a generation behind. So what that means is that the women and the girls have greater health literacy. They understand it, the way they think about it, the way they speak about it, the way they share, the way they behave around their health and wellbeing is a generation advanced on the men and the boys. This policy can change that. From a psychosocial, economic and social point of view, improving men's health and wellbeing is better for men, their wives, partners, their families, their kids, the community and the economy. When a man is healthy and well, not only does he thrive and flourish, but those around him tend to also thrive and flourish. And this is true in families, workplaces and communities. Now, we have much work to do to get that situation going. Now, we also will have the benefits of that. We absolutely will have the benefits of that, but we need to turn the tap off, or the taps off, to stop producing the fearful, isolated, angry, unwell men. So supporting the health and wellbeing of men and boys needs to be recognised as a whole of community issue. This should include a focus on promoting and facilitating men's, boys' healthy living and lifestyles, and strengthening health and community service delivery to men, not just clinical services. The male health and wellbeing sector in WA is growing. There is an existing network of services and groups that can be supported as a vehicle for improving men's and boys' health and wellbeing outcomes. All services must recognise and address the health and wellbeing needs of men and boys and ensure that they have a more strategic, coordinated and gendered approach to those men and boys. Because of the health literacy thing. That's why. So services need to address and start to understand that men and boys do not think, understand, communicate and behave the same way as women and girls around their health. So a policy approach that can engage and empower men and boys and align the systems, services and communities that support them is urgently needed. The benefits of prioritising and addressing men's, boys' health and wellbeing will be far-reaching, not just for those men and boys, but also for their families, the community and the economy. It ripples out. The development of the Western Australian Health and Wellbeing Policy is the first step towards recognising this important issue and calling people to action in WA. I really encourage all of us to do what we can to promote this policy and make our state an even better place for all of us to live. I'm sure you're all going to work wonderfully at the tables together, and I wish you all very well in your endeavours today. Thank you very much already.